My name is Bev Smith, and I'm the Executive Director of Kidsports, and I just want to thank you for being a part of the Kidsports team. We look to use all of the incredible community resources that we have in Eugene and Springfield, and one of those is Slocum Orthopedics. We have them as a resource to help you navigate some of those injuries and some of those bumps in the roads that are bound to happen when you play any kind of sport or activity.
We see over 275,000 patient visits a year, and many of those visits are related to injuries that are preventable. Kidsports and Slocum working together is just a great partnership for Slocum to get the word out on how to avoid injuries when you're playing sports.
Most common wrist injuries that we see in youth sports is a sprain, and that's typically from falling out onto an outstretched wrist. Most kids with a sprained wrist will have swelling and pain, but no bruising. And they'll have pretty good mobility of the wrist. As long as there's just simple swelling and good mobility, you can easily buy an over-the-counter brace and rest for a week or so until the mobility improves and they can use their wrist better without pain. But if you see a lot of swelling and bruising, you should probably see someone for an x-ray. I tell parents if they can't do a push-up off the floor without pain, they're probably not ready to get back into the sport. When they break their wrist, it can be a little bit of a longer recovery. When we see growth plate injuries, we're usually in a cast for about 4 weeks and returning to sports somewhere around 5 to 6 weeks.
Ligaments in knees is the soft tissue support of the joint. One of the most important things as a parent or somebody that's been injured is to think about, I got injured, what does my knee feel like? What does it look like? Am I swelling? Rapid swelling after a knee injury is a very important sign that your knee needs to be looked at right away. I think as a parent, if your child injures their knee, I would have them take a break from whatever they're doing. So I wouldn't have them go back in and play sports immediately and watch them. When a child starts walking normally, when they're worried about something else, that's a good sign their knee's going to be okay. When they cannot be distracted, when they are focused solely on their knee and several hours have passed and they are still talking about their knee, that's a worrisome sign. When you first have a knee injury, there's some very helpful things to consider. One is the acronym RICE, which you may be familiar with. Rest, so you're gonna stop whatever you're doing at that moment. Ice, some cold compress on there to help with swelling. Compression, so you'll wrap the knee with an ACE wrap. And elevation, getting that knee above the level of your chest to help with the swelling. One of the best things you can do to prevent a knee ligament injury is year-round conditioning. A cross-trained, physically conditioned athlete is the least vulnerable person, so you want to be that person.
The good news is the vast majority of ankle sprains get better just with time. When somebody sprains their ankle, the most common way it's sprained is with an inversion type injury where the foot rotates, in relative to the rest of the leg. Common, symptoms after that would be pain along the outside of the ankle, swelling at the outside of the ankle, bruising most commonly on the outside of the ankle. Initially it wouldn't be uncommon for, an athlete to have trouble putting weight on the ankle. If an injury is severe enough to where you're not able to put weight on it after 2 or 3 days, then it warrants an x-ray. Return to sport after an ankle sprain or really any injury is just having near normal strength when compared to the other side. So I think one of the things that we're trying to prevent with getting somebody back to sport is to prevent another injury if they're, still recovering from their previous injury and aren't quite ready to go back.
So what makes us worry about whether someone's had a concussion? Well, almost always it's going to be predicated by a blow to the head or the body. And typically those symptoms are going to come right at the time of injury. And those symptoms are very often going to include headache, nauseousness, dizziness. Sometimes we'll see vomiting and just a generalized confusion. If you're suspicious that your child has had a concussion, you don't have to take them straight away to the emergency room, okay? There's nothing wrong with just making them comfortable. The number one thing we want to remove from activity. Now, if they seem to have increasing confusion, increasing headache, if they have more than one episode of vomiting, those are the triggers that I would say, then you want to go to the emergency room to be further evaluated. Otherwise, if symptoms seem to be not severe, totally fine to let them sleep. You do not have to wake them up every 2 or 3 hours. It's okay to use some Tylenol or some ibuprofen if they're having headaches. And then I would definitely recommend calling your family medicine doctor or your pediatrician and getting them in to be seen within a day or two. When it comes to returning to sport after concussion or a suspected concussion, there's kind of the one big thing from a sports standpoint is that there is a state law. Every kid who's had a suspected concussion or a definite concussion needs to be evaluated, and then we return them back to play on what we call a return to play protocol. So it's not just signing off and saying, hey, your concussion's better, you can go out and do a full practice tomorrow. It's a stepwise increase in activity over a 5-day period. If it's a kid who's younger than high school age, the healthcare provider and the coaches are going to have to make sure that they return through those steps of the protocol before they're able to fully get back playing.
Thank you for taking part in this video series. We hope it's been very helpful, and I think it reflects how much we care about your child's experience here in our youth sport programs and how much we will use community resources like Slocum to provide your child with a wonderful, warm, safe, and exciting season of sport. Thank you.